Hello, I'm Estelle from the Bodyworks clinic, and I'm here to teach you some knee exercises in case your knee operation has been postponed. Exercise number 1 is, now I've got a squishy roller that I seem to have had for years and years and years, but you can use a folded up towel, which is what I usually recommend people do, or you can get yourself a fancy roller from some outlet somewhere along the way. But this exercise that I'm going to teach you now is to get your muscles strong, which will help you walk better. So if you have your roll nicely situated underneath your knee, you're basically going to push your knee down onto the roll as tight as you can, using these muscles on the top of your thigh. If you work them hard, your foot will pop off, and then you can relax it back down again, and the muscle will relax. And you can do as many of those as you possibly can until you can do no more. Then have a rest, come back later. Ideally, I would get you doing your good leg first because it has got the plan. The other one may have forgotten it. So start with the good leg and then do it with the sore leg. And the stronger you get, the better the sore leg will get. Now the next part of your exercise regime is to stretch the leg. You can see I've moved the roll down to my ankles. You can put a towel just underneath your ankle, or if you're allowed to, put your foot on the coffee table and let the knee hang. It won't be very comfortable to begin with because you're trying to get it straight, and when it's being bent, all the muscles at the back are very tight. So little by little you can rub it, you can guide yourself using the other knee, but little by little you want to get that leg straight. Put the television on so that you've got a diversion, and see how long you can keep it there. It might only be 2 or 3 minutes at the start, and then suddenly you find you can keep it there for 5, going on for 10. So the more you do it, the easier it will get. Exercise number 3 is where you try and stretch this leg a little bit. Now you can use a dressing gown belt. I have a band here. You put that over your foot and then you hold on tight. And the idea is that you lift the leg and stretch it. Now most people go off me at this point because it's quite an uncomfortable thing to do, and I can feel it stretching my knee and I don't have a problem. So you do that for as long as you can until you absolutely can't bear it. I would be kind to yourself and guide it back down. Don't just let it drop, because that's uncomfortable too. Do that as often as you can, and little by little you'll find that it gets easier and easier. Now, if you have any questions or those exercises just feel a bit uncomfortable for you, don't hesitate to give us a call.